We're going to continue our coverage of the Canadian wildfires, which have blanketed the New York area and much of the East Coast in smoky skies right now.
New York, the last 2 days had the worst air quality of any large city in the world. So what exactly does breathing in this air do to our bodies?
Here to tell us about the potential dangers is Lisa Casale. She's a pulmonologist at Hackensack University Medical Center. So Dr. Casale, thank you so much for being here. We appreciate you.
Thank you. Thank you for inviting me.
So this is an important topic, right? Because all of us are feeling so many things, scratchy throats. Hazel and I are coughing this morning because of what we're experiencing. Have you had patients coming in with these breathing troubles, and not just folks with already underlying conditions?
Yes, because the air quality is so poor, we have even people who have normal lung function coming in with a lot of problems. The problems are mainly caused by the particles from smoke inhalation and smoke exposure. So they can start anywhere from your eyes, as you described. We can have watery eyes, runny nose, sore throat, irritated throat, headache, cough, all leading to shortness of breath. And in people with underlying lung disease, we also are seeing flares of asthma and COPD, and additionally flares of any underlying lung disease that patients might have.
Well, I mean, I guess it goes without saying, but what was interesting is walking around the city, you saw a lot of people wearing masks, but then there were plenty of folks, some of them even running in the park with no masks at all. So how imperative would you tell those folks that it is to wear masks if they're outside?
Right. I think it's imperative to have actually either an N95 or a KN95 to protect yourself. You definitely don't want to be out there inhaling particles. It increases your risk for, again, cough, shortness of breath, and any kind of lung dysfunction. I'm sure as time goes on, we're going to see more effects from the toxic smoke, and we can even see, some permanent effects, increased risks for pneumonia as we proceed, and diminished lung function. So I think we have to prepare ourselves and be very cautious.
Yesterday, one of the health officials here in New York City compared this to the equivalent of smoking a pack of cigarettes in just one day.
Right. We know it's toxic to your lungs, so.
Yeah, absolutely. So I think adults obviously are always worried about themselves, but some parents are worried about their kiddos as well, and what exactly they can be doing besides just like an air purifier in their room. So what's your advice for those with young kids?
Right. Even people with young kids, again, like everyone has been saying, stay inside. If you use any medications for asthma or COPD, make sure you're using them on a regular basis. Make sure you stay hydrated. Keep your air conditioning on and recirculate the air within your house. Keep your windows closed. Avoid any time, going outside. If you do need to go outside, I would recommend limiting the time outside. Wear a mask. Avoid any strenuous activity, and try to stay well hydrated.
And then what about those air purifiers that a lot of us either have, or maybe a certain person sitting next to me just purchased another one for their home? How well do those actually work in helping, filter out this air?
I think a HEPA filter, on your air purifier, yes, would probably be helpful. But again, I think you need to do everything. So